So in patients that are in this red light category that can't take estrogen, there are functional medicine alternatives so that we can give them protocols to help in those same areas. So for bones, it's organic calcium like hydroxyapatite, vitamin D, row isoacids, vitamin K, weight-bearing exercise. For cognition, it's about reducing stress because stress actually can destroy hippocampal neurons and lead to cognitive issues. It's about normalizing insulin and glucose because of the effect that elevated insulin and glucose have on cognition. Giving supplements like huperzine A and proline-rich polypeptides, which help increase acetylcholine levels in the brain, or SAMe, which helps with methylation and methylated B vitamins. How do we achieve heart benefits? We can give coenzyme Q10, arginine if we have to, good omega-3s, and supporting the mitochondria with carnitine, lipoic acid, and other mitochondrial nutrients. So what about the yellow light? This is the most important group because the yellow light is where most patients fall. So for example, so many of my patients have elevated blood sugar and elevated insulin. That's a risk factor because it can lead to increased estrogen levels. So insulin directly stimulates the enzyme that produces estrogen. So we have to control that process. In fact, it's known that women that have elevated blood sugar and elevated insulin, not only do they get more breast cancer, so it's more frequently diagnosed in that group, but if you are diagnosed with breast cancer and at the time of your diagnosis you have an elevated insulin level, then you have an increased risk of doing poorly with your cancer.